Hello everyone, good afternoon everybody. I am Priyanjali from Radiance with You YouTube channel. I'm sure all of you must be keeping good health. Today let's dive into a topic that affects a lot of people but often doesn't get enough attention. Hair related disorders. Whether it's hair thinning, dandruff, or conditions like alopecia, this issue can have a big impact on both our physical health and emotional well-being. And just like a fungal infection, the earlier we take action, the better the results. Hair disorders can range from mild to severe, affecting people of all ages and backgrounds. Things like stress, hormonal changes, poor diet, and even environmental factors can contribute to hair problems. Some of the most common conditions include hair loss, both temporary and permanent, dandruff, scalp infection, which can cause discomfort, itching, and even embarrassment. But here's the good news, just like with any health issue, awareness and early intervention are key. We can keep steps to prevent hair disorder before they start, or at least minimize their impact. By understanding the causes, adopting healthy habits, and using the right treatments, we can protect our hair and maintain its health for the long term. Let's focus on how we can prevent hair related disorders, recognize the signs early, and explore the latest treatments and solutions that can help restore and maintain our hair health. Whether it's better scalp care, nutritional improvement, or seeking professional advice, we all have the power to take care of our hair and keep it looking its best. Joining us today, a distinguished expert in skin and hair care, Dr. Kruti Jain, MD dermatologist and hair transplant surgeon. She is the founder of a Cherish Skin and Hair Clinic in Chhatrapati Sambhajinagar, Aurangabad, where she provides advanced treatments ranging from acne care, PRP, and hair transplants to laser therapies and tattoo removal. With her expertise and commitment to patient centric care, Dr. Jain has become a trusted name in dermatology and aesthetic medicine. We are delighted to welcome her to this session. And with that, I would like you to join us in the screen, Doctor. A warm welcome to you. It's a pleasure to host you today. And let's begin with the kind of hair disorders. Begin the
Yes.
basic kind of hair disorders. How does we begin with it?
Okay, so you want me to tell you about the fungal infections which can lead to the hair disorders. Am I right?
Right, right,
Yes.
right,
So
Doctor.
basically, what happens in fungal, yeah. So what happens in fungal infection? It affects three of your major body parts. Number one is your skin, where we can see the red colored ring-shaped lesions on our skin, which are very and extremely itchy. And second, it can have a scaly flakes on it. Secondly, it can affect your nails, which can lead to the discoloration of your nail and easy breakdown of your nail. Sometimes it may cause permanent damage, as you correctly said so. And thirdly, it may affect your scalp and hair. In the scalp, it may cause itching, redness, some discoloration, or some flakes, or which you commonly call it as dandruff. And in later on, they can lead to the hair loss, which can be permanent or temporary. So if you take the correct treatment earlier, then you can prevent the hair loss and your damage to the skin and nail.
Right. Doctor, speaking about hair loss, tell us what is the most common way that we can lose our hair in today's time? Because hair loss is one of the major concern, irrespective of the age and gender, of course. Everybody is going through it, and people are very much concerned. What is the main thing which is leading to this hair loss?
Okay, so the main thing which can cause your hair loss in today's generation is your lifestyle. That is the one and foremost important reason. Because see, many people are indulging into the addiction part of the thing. Like if they are going towards the smoking, alcohol, or even the passive smoking can lead to the hair loss. One thing. Second, the nutrition or the diet is not that much efficient or sufficient for their body and for their hair. And lastly, what they do is they keep on tying on their hair, doing all sort of procedures like coloring and straightening of their hair, which can lead to the damage to the strands or lengths of the hair and eventually can cause the hair loss.
Right. So we are saying that the lifestyle is one of the major reason why we are losing our hair at such a rapid rate. So what are the major
That's correct.
things that we miss out in our routine that we need to take care of?
Okay, so one thing, take adequate amount of water, keep yourself hydrated. Then keep a check on your diet, like antioxidant rich diet and diet rich in omega 3 fatty acids, vitamins, and minerals are good for your hair. And last, your protein rich diet is also foremost important. Then what you can do
Right.
is reduce the amount of styling of your hair and coloring, your straightening, keratin treatment, and etc. Then what you can do, regular checkup of your health, which we call it as like routine CBC, whether it is leading to any loss of hemoglobin or reduction in the hemoglobin level, any thyroid issues, and etc. And then
Mm-hmm.
what you can do, take adequate amount of sleep, which is also foremost important to prevent the hair loss. And last but not the least, some hair products which we commonly use as shampoo, conditioners, which may prevent the damage to your hair strands or hair lengths, which may later on prevent the hair loss. Yes.
Right. Right. Well, now we are talking about the kind of lifestyle which one should maintain, like getting adequate amount of sleep. So if we talk about the adequate, let's begin with this only. If we talk about the adequate amount of sleep, what is uh, the normal amount of sleep which one any individual should normally have?
Okay, that is one of the trickiest question, even for a doctor to answer. But I'll tell you. See, up to 6 to 8 hours is a good amount of sleep which you can have. But see, we are not
Hmm.
the Prime Minister or Shah Rukh Khan, which we can have 2 or 4 hours of sleep and that is enough for us. No, 6 to 8 hours of sleep
Right,
is must. And if you want, you can extend it. It's not like that. That is only the only
right,
time which you can sleep. You can extend it up to a certain limit. And also, if you want, there are some hectic days which you cannot take adequate sleep on that those days, then you can have a smaller amount of sleep as well, shorter amount of sleep. But
right,
6 to 8 hours is just sufficient. But that should be your deep sound sleep. That is the most important thing. See, you're sleeping, you're going in the bed, but you're just checking and scrolling your phone, Instagram, and everything. And you're not taking a proper sleep, then it's of no use. And secondly, uh,
right.
fix your time of sleep. Fix the time of your sleep. Like
Hmm.
if you're going to bed by 10 or 11, then get up by 6 or 5, that is good. Or don't extend
Mm-hmm.
it beyond the 12 in the night. Yeah.
Right, right.
Yes.
Well, these are the few things about sleep. Now, coming to diet, the food related things, very important when we are talking about our skin or our hair. Food plays a very important role, as you also clearly mentioned, doctor. Uh, Now, the food which are available, as we know that nowadays the nutritions are not sufficient enough in the foods, the fruits or the vegetables we are eating, the nutrition we are not getting it sufficiently. In that case, what do you recommend? How do we fulfill our nutrition? May it be protein or the right amount of fiber we are talking about, omega 3 fatty acid, whatever we need to grow our hair. The kind of do we should we get it from the food or the supplements which are available in the market?
Supplement.
Which one would you suggest?
Okay, so what I can suggest is, see, now with the current going lifestyle, the amount or the nutrition of the amount of the nutrition which you are getting from a diet is not that much sufficient. And secondly,
Right,
all the crops which we are getting at our home is a hybrid. So it is not having a sufficient amount of nutrients, minerals, proteins, and XYZ, every other components which are required for a skin and hair up to that much
mm,
mark which is required. Okay, so we may need some
right,
supplementation, or what you can do is increase the amount of your diet. So what we tell our patients to take sprouts, then they can have
mm,
salads and fruits. But what they do, they take a one or two slices of cucumber, tomato, and they say that, ma'am, we have enough amount of salad and sprouts. You have to take a bowl full of sprouts for your hair
right,
and for your skin and nail as well. And lastly, what you
right,
are consuming, just keep a watch on that as well. Like paneer, your egg white part is having a good amount of protein for your hair, and then salads and your fruits will provide you with the minerals and minerals and vitamins part. But keep on checking changing your diet. Not a constant diet can provide you everything. So one day if you're having a rice and your dal and your bhajis, and the next day you can have a chapatis, or you can mix them up, jumble them up. And if you're taking a non-veg component, then I would, this is my personal recommendation, that don't take a processed meat like red meat and etc. White meat is good to go. Lastly,
Right.
supplementation you have asked me about, right? So you, with today's world, we might need the supplementation which contains,
Mm,
like you said, correctly said, omega-3 fatty acids. Then you need to have
zinc.
vitamins, minerals in a sufficient amount,
Right.
your iron, zinc, calcium, and
Mm,
then your vitamin B12 with multivitamins and everything. And
right.
last but not the least, protein. So with protein supplementation, what people are going, they are going towards the gym, having a good lifestyle. Okay, that is a good, but don't take the protein which contains whey proteins, which is not good for your health. So try to
Right.
reduce the amount of such packed protein which are getting, or the protein powders or creatinine powder which are containing whey proteins in them. It may lead to the acne
Right.
breakout, eventually hair loss, and some other hormonal imbalances in their body. So what is the
Mm-hmm.
alternative? There are certain proteins you can meet the components of it, and increase the protein amount in your diet, like through tofus, your paneer, and then egg white part, just like I've told. So, and
Mm-hmm.
chickpea, in not chickpea, what do you call it, as they chana dal sprouts and everything. That is a good
Right.
thing which have lots and lots amount of proteins in them.
Right.
Yes, sir.
Well, with that, doctor, that was the food part about it. Because we are talking about supplements here. Tell us, can medicines also, over-the-counter medications also lead to hair loss at times?
Over the counter medicines which contains steroids and which can lead to the hormonal imbalances in your body, then which can lead to
Mm-hmm.
a good amount of your GI upset and everything, which leads you to have a which can cause you to take a smaller amount of what do you call it as diet. And certain medications do have their side effect as hair loss in our practices as well, and in common practices as well. So yes, OTC medicines can lead to hair loss, so don't go with them. Go to a expert dermatologist nearby to your OPD, nearby to your home, or you can have a good physician which can guide you, who can guide you well to take the best medicine or the required medicine with for your illness, which cannot lead to the hair loss in the future. But yes, OTC
Right.
medicines do cause hair loss, so keep a good aware of it.
Right, right.
Yes.
Well, with that, let's dive into another major issue of the current time, which is graying of hair. Major issue
Oh,
nowadays, because we see people of all ages suffering from this hair graying.
I
What is the major reason? What can be the main reason
mm,
behind it? Earlier we used to see people in their late 30s also
for
not having gray, like they do not have gray. Still
single hair
I'll
also.
tell you,
Yeah.
because
Mm.
I'm very fond of traveling. Still there are regions where people they have late graying of hair. What is the major reason behind it, doctor?
If you ask me majorly, there are few reasons like genetics. If their parents have had it, then the patients or
Mm,
the clients can have the early graying of the hair.
mm-hmm.
Nowadays, which is the most common cause, is your diet. All things come round and round to your diet only. People are not taking good
Right.
amount of diet. There is fondness of food. They do avoid. They are picky about their food. They do like burgers, pizzas, and ice creams like anything, but they don't want to take your veggies, which are good in the vitamin B's, which is required for your hair and everything. Then comes the role
Mm-hmm.
of certain medications, then hormonal imbalance, which I was talking about. So the thyroid issue
Right.
can also lead to the early graying of the hair. And there are
Right.
few other things like overexposure to the sun, which can cause the
Mm,
premature dying of the cells which are providing the color to your hair, can cause the early
right.
graying of the hair.
Right.
And inadequate amount of sleep, taking too much stress, may lead to the early graying of the hair, which was
Right.
earlier seen after the 50s or 60s. There are certain people still in their 60s and not having a single gray hair on their scalp.
Right.
But still, you can
Right.
see a 5 year, 6 year old child who has earlier graying, all because their
Mm-hmm.
diet issues, they're not having a good sleep, and they're taking, now the parents are also putting too much pressure on their children to go to these classes, that thing. You have to come first in everything, everywhere, in academics, you say, or in other curricular activity, extracurricular activities. So the children are also getting so much troubled and stressed because of all such things, and they are showing premature graying of the hair.
But the main question arises here is how do we deal with this, or is there any cure to this?
Okay, so the earlier the treatment, there is a cure positive which can prevent the
Mm.
further hairs which are going graying. So which can prevent the further graying of the hair. But the once you have got the gray hair, it is slightly difficult for us as well to convert it back to the what you call it as blackening of your hair. But yes, there are certain treatments available. So with these treatments, what we are doing is we are giving the good diet to the patient, we are giving the supplementations which I have earlier talked about, good amount of proteins
Right.
and everything, and then good lifestyle changes like quit smoking, quit alcohol, take adequate sleep, reduce stress, go to the gym or do the meditation, yoga. Then comes the role of certain medications which are coming nowadays in terms of serums. What they do is, or serums or some shampoos and also medications. So what they do is they stimulate the cells which give color to your hair. So with that, the black hair which are still there on your scalp will lead to the other hair cells to grow now black in color. The previous gray hairs which were there, now they will turn black now. So yes, there are certain treatment available now, but you need to take a
Right.
good consultation from a good dermatologist who is aware of such treatments and who is aware of the cause which is causing the graying of the hair. Yes.
Right. Right. Well, this is one of the major issue, and I believe it could be helpful for all the people who are watching us right now. Now, because we are talking about treatment and treatment options, doctor, let's talk about the rest of the treatment options also, which is related to hair loss. What are the current treatments which can treat hair loss?
Okay, which can treat the hair loss. So one goes with the, we can divide it into certain topics. Like one is oral supplementation, then active
Mm,
medications, then procedural treatment. So with oral
mm,
supplementations, like I've said, certain medications are there, or you can take the IV treatment as well for those nutritional deficiencies. Okay, then
mhm,
comes the role of the actives. So what actives does is they work on those area which is causing the hair loss. Suppose you're having hormonal imbalance, or you're having root problem, like hair roots are weak and strands are weak, or you're not getting enough blood circulation towards your hair, so they can improve that part. Those, there comes the role of actives. In those we have certain minoxidil you can take, you can take, or certain peptides, then stem cell therapy and everything. Then comes a procedural treatment. In procedural treatment nowadays, which is going popular like anything, is a PRP. So PRP is
right.
platelet rich plasma. With that, what we do is we prepare the PRP from your blood only. You have seen sometimes
Mm,
we get a scratch, there comes a blood, then there comes a new skin. So your blood has a capacity to grow the new skin. Similar way, your blood has a capacity to grow the new hair as well, with the role of
okay.
your growth factors. So PRP has a concentration of your growth factors in very much higher amount, which a very well known
Mm,
dermatologists know how to prepare a PRP. There are certain
right.
GPs and other parlor people also who are doing the PRP, which is not recommended by
Mm,
a dermatologist, I would say. So
right. Right.
PRP we injected on your scalp or the area of hair loss, and then we can prevent the hair loss. It will, what
Mm,
PRP does is, new growth factors are there, it will lead to the new hair growth. And secondly, the existing hair, it gives strength to them so that we can elongate the lifestyle of those hair, life
right.
cycle of those hair.
Right. Now, because we are talking about PRP, let's educate a little bit more um, about the current concern. Now, uh, is the
Hmm.
let's start with the basic one. Is the procedure painful? Because we have heard people saying that it pains and the pain is sometimes unbearable. Please clear the myth, doctor.
See, the procedure is injectable procedure. So there is certain amount of pain in the procedure, but to reduce that pain
Mm,
also we can have anesthetic cream or numbing creams which are applied prior to the procedure. Then what I
mm,
personally do is I give 2-3 blocks over the head so that from this area up to the back of your scalp goes numb. Then I can give 100 plus injections of the PRP painlessly.
mm-hmm.
Then what we can
Right.
do is we can there is a PRP painless PRP machine as well, or meso gun which we call it in our language, which delivers the
Right. Right.
PRP with the lesser amount
Mm-hmm.
of pain. And now with the advanced treatment, the earlier the way the PRP was made, it was causing pain because the component of the PRP was itself having the pain in them, or the
Mm-hmm.
certain components were there which were leading to the pain to the patients. Now, with the advanced PRP making technique, we can reduce the amount of pain with that thing. And secondly, GFC PRP, you might have heard the term, or growth factor concentrate, which is having
Mm-hmm.
a 4 times or 10 times higher the concentrate of growth factor which were there in the earlier PRP. And the pain part has
Right.
also been reduced with that. But apart from that time of pain, like during the procedure, which is of half an hour and so, apart from that there is no pain. There is slight head heaviness on the same day, and no pain, no
Mm-hmm.
headaches. Patient will not experience any what do you call it, migraine sort of pain or a band like pain. No, nothing like that. There is slight head heaviness, but it depends on the patient's
Right.
pain tolerance as well. See, females cannot tolerate much of the
Hmm.
pain, and
Right.
males can
Right.
tolerate. So there comes a role of
Right.
the gender as well, your pain tolerance as well, and your enthusiasm of getting a good hair. अगर आपको बाल चाहिए है, if you want to pay, if you want hair, no pain, no gain. Yeah.
Right. Right. So generally, how many sittings do we recommend for to see like evident results?
So it is customizable depending upon the cause of the hair loss. In male pattern or female pattern hair loss, 3 to 6 sessions
Mm,
are enough, which can be given monthly apart or bi-monthly apart. Then we can put
mm-hmm.
those patients on the maintenance therapy as well, because see, female male pattern hair loss is a long going process or ongoing process. See, so it might require the
Mm-hmm.
maintenance treatment as well. Then if you're
Right.
having acute hair loss, like in 2 or 3 months suddenly you have experienced hair loss after your pregnancy, after your some major illness, or after some stress related event, then 1 or 2 or 3 maximum sessions of PRP are enough. Other causes of hair
Mm,
loss like alopecia areata, fungal infection, 1 to 2 sessions along with your active medications are enough. What I
right.
have seen, people they do give package PRPs, like a yearly package, monthly, every month the patient is going getting the PRPs but not getting the results, and
Mm,
they do continue to go to those doctors because they have paid them in advance. So don't go for the
right.
package PRPs. Just customize your PRP which is required for your hair loss, the reason which you're having the hair loss, and take the call accordingly. Just because मिल
Right.
रहा है तो ले लेना है, that is very wrong. Yeah.
Mm, right. What about the monetary
Two,
part, doctor?
three, and up to 6. Yes.
Right.
I can we elaborate your question like monetary part? Acha, for the PRP treatment as well. For the PRP treatment
Yes,
only you are
yes.
talking about?
I'm talking about the PRP only.
No. Yes, okay. So that is why I've quote that you don't need to take the package sessions of the PRP. Customize it according
Mm,
to your disease, and then get it done from a good dermatologist. These procedures are not that much costly. It is budget friendly. You can get it done in, I think, certain people where the doctors are practicing in the periphery in around 1500 or 2000, and in Mumbai and three-tier cities they are charging 10K as well for the same procedure. But depends how they are doing it. Just like I told,
right.
like GFC have more growth factors concentrate. To might You might have a higher amount of the price which you might have to pay for it. And the plain
Right.
PRP, it is not very much costly. 2000 I think is a should to 3000 should be an average amount which you have to pay for one session, ma'am. And then if you
Right.
want to continue in 10,000, I think you're getting the whole amount of the procedure done on you. Yeah, yeah.
Wonderful. That's wonderful. What about uh,
Hmm.
the side effects, or are there any side effects, or uh, is it so that once the treatment is done, we will see the shedding happening again?
With after the PRP, see if you choose a
Yes.
good dermatologist and if he or she is experienced in doing the PRP, then there are no side effects as such for the PRP. Apart from which I've told you, just head heaviness could be there or slight pain during the procedure. Apart from these, no side effects of the PRP. Yeah, patients do get scared during the procedure or before prior the procedure, they do get the panic attacks or they might experience the blackouts. So these are
Mm-hmm.
patient related side effects. And if your
Right.
doctor or the person who is doing the PRP, he doesn't follow the safety protocols or cleanliness, then you can experience the infection on the certain area, which can lead to the serious illness or serious infection as well. Then you may have to go or take another treatment for the same. And
Right.
otherwise, PRP is very safe, ma'am. No issues with the complications and everything. You are
Right.
good to go if your doctor is experienced in doing the PRP and how he can customize it for you. Like I said, the customization is most
Right.
important, most important
Right.
part of it. Yeah.
Right. 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 Doctor, let's also talk a little bit about alopecia. Just to educate everyone, we know what is alopecia and alopecia areata. Both the things. If you could please explain a little.
See, so the term alopecia means having a hair loss. So
Mm.
alopecia means hair loss, that's it. So hair loss can be of certain XYZ reasons: nutritional deficiency, your postpartum issue, your post pregnancy issue, genetic issue, thyroid issues, then not taking good amount of sleep. And then comes the role of alopecia areata. So area has a area word in it, leading to the which means certain area of hair loss or patchy area of hair loss on your scalp or everywhere on your body. It can be also present. So alopecia in general means hair loss, and in alopecia areata it means having a patchy hair loss. So in alopecia
Right.
areata, or we call it as AA, you're having immunological issue. Your immunity is so much high that it is damaging your hair, which is leading to the hair loss. But with appropriate treatment and advanced technologies, it is completely reversible. I have one patient with me currently. She is, I think, 50s. She's in her 50s and 60s. She didn't get the proper treatment earlier. She had complete baldness on her hair. Now I've started her on good medications, and she has full growth on her scalp with the appropriate treatment and with PRP as well. So in alopecia areata, you're having hair loss because of the immunological issue, and alopecia is an umbrella term under which comes alopecia areata. Yes.
Right. Doctor, the right management for it, the treatments which are available, and can it be cured?
Alopecia areata, yes, it can be cured with the current treatment. If you're having certain one or two patches on your scalp, like topical or creams and everything will work for you. A local injection of the steroid or certain medications over the same area might work for you. Then comes if you're having multiple patches or more than 50% of hair area loss, then we can go with the oral medications. There are few medications now available with advanced technologies and with lesser side effects. Then comes, like I said, PRPN as well, which can help to regrow the hair. First, we need to stop the hair fall or regenerate the hair, then regrow the hair. So, with PRP, we can
Right.
experience the regrowth of the hair, and minoxidil as well work for it. So, like I said, customize the treatment for you.
Right. Right.
Yes.
With that, I believe we came for a very small period of time. I wish we could have more time with you, doctor, because there is so much to learn. I can see a lot of concerns from the viewers, and I think most of we will not touch those topics that we have already spoken about. But I can see one
Coconut oil,
question coming
correct.
up from a viewer who asks about oiling. Please, if you could say a little bit about oiling, if it can be safe to use. If yes, what is the right way of using the oil and which oil to use?
Oiling of your hair. Yeah.
Yes.
See, for oiling, there is a myth like how put regular oiling of your hair will prevent your hair fall, will prevent it from the earlier graying, will prevent it from XYZ, smoothness it prevents and everything. So most of it, the terms, these all terms are myths. The oiling prevents the frizziness of your hair, which and it what do you call shininess of your hair. Yes. So what oil should be used? Coconut oil, rosemary oil, almond oil, all are equal. But coconut oil is easily available in India. It is cheaper, economic. You can have it, you can use it. How to use it? Now comes the part. Use it on the lengths of your hair, on the strands of your hair. 1 to 2 hours prior
Mm,
to your shampooing. So what you can do on Sundays, suppose Sundays, everyone in India washes their hair. So put oil on your strands or lengths of your hair. Certain amount of oil you can put on your scalp as well. Then after an hour or two, you can go for the shampooing of your hair. Take a smaller amount of shampooing only, which is shampoo which is required for a scalp cleaning only. Scrub it, rub it. Then while washing off your shampoo, use the put the shampoos on your lens as well and remove the excess oil which you had put during the chumping time and everything. And by this way, you can prevent the natural oil from your hair. So daily oiling is not required. Overnight oiling is not required. Oiling 1 to 2 hours prior to your hair wash is sufficient, or half an hour prior to your hair wash is sufficient. Daily oiling or overnight oiling can lead to the dandruff issues as well. So keep a check on that as well. Coconut oil, like I said, rosemary oil, almond oil will do. There is nothing like oil can have the effect on your hair loss. No, oiling cannot prevent your hair loss. Oiling will not help in regrowing of your hair. There are certain studies, or few studies only, which says that rosemary oil can lead to the regrowth of your hair. But with active treatments nowadays, I don't think that oil is the only treatment which is available for your hair growth. There are certain medications, Baba, which you can take from a dermatologist. Why to go for the oiling only? And last but not the
right.
least, I'm not promoting or de-promoting anyone, but the Ayurvedic oil or Adivasi oil and oil and everything, they will not prevent your hair fall, will not lead to the hair growth of your scalp. Yeah, most importantly.
Right.
But I'm not
Right.
promoting
Well,
anything
that
or
was
de-promoting anyone.
right, right. Well, that was a wonderful session with you, doctor. And as I already mentioned, I wish we could have had a little bit time more than this, so that we could know a little bit more from you as well. We still have a lot of questions, but uh, I'm I'm really, really honored to
Get
host you
time
today.
constraint.
And it was such a wonderful session. It was such an informative session. I believe our viewers enjoyed the session thoroughly. Thank you so much once again for your valuable time, Doctor. It was a very informative session. I'm glad to hear from you. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. Uh, you all stay connected to our page, Chan Radiance with You, and we are also available on YouTube, Twitter, and Instagram. You all stay safe and stay healthy.
Yes, ma'am. Yes. Thank you, Pranjali.
Thank you so
And
much, Doctor.
I here take a yeah. Yes, yes, yes. Thank you.